Hi everybody, I'm Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com, and today we are going to talk about preventing tantrums. I'm super excited to talk about this. We're going to use functional communication training, and this is a procedure where you are helping your child to use communication instead of the maladaptive tantruming behavior to get their needs met. And so let's start with some background. Basically, whenever we think about young children, they don't have fully developed language, and it can be pretty hard for them to form phrases and sentences to convey their emotional needs or even their physiological needs well. And that level of difficulty can be pretty frustrating too. So sometimes they can't say what they need, and sometimes the difficulty level required to say what they need is overwhelming itself. This can lead to problem behavior, whether it's aggression, destruction of property, screaming, just throwing themselves down on the floor, all kinds of things. The typical tantruming behavior. And so today we're going to talk about how do we help your child to start utilizing communication instead of those maladaptive behaviors. So let's just take a break right here. And I want to just say that this is not a therapeutic video. I'm not trying to provide therapy to you guys. If you're having a specific problem with your child, I highly encourage you to talk to your child's pediatrician and for you to seek out therapeutic support as needed. This video is just for education and entertainment purposes. So let's get started. Functional communication training is where you are replacing the maladaptive behavior with some sort of communication device. That could be a gesture, or it could be a word, or even a phrase. And so whenever you're thinking about your child, I want you to think about what level of communication they're at. I'm sure you've heard of those babies who are super young and don't speak yet, and how they might use sign language to indicate that they want another bite of food. This is a great functional communication training method to prevent a child from yelling out or crying because they want to eat another bite. And so the child just does some sort of either American Sign Language or some sort of family known gesture to tell the parent or caregiver that they want another bite. And therefore, the maladaptive behaviors decrease. Now, if you had an older child, one who is starting to do sounds, you might actually have them do a sound approximation. So, ba for banana, or ah for iPad. You could do any kind of sound, really. The nice thing about sound approximations is they are the first step towards the full word that you want your child to say. So you're starting to build more complex language and you're building their vocabulary. Now, if your child's a little bit older or a little bit more advanced in language, then you can absolutely do phrases like I want more or just want more. And then if your child's even older than that or more advanced with their language skills, then you can start adding in more complexity as well, like please can I have some more? Or thank you for offering me the peas. I'd like more, please. That was pretty advanced. So as you can see, you really have to know where your child is with their communication in order to know what the appropriate functional communication tool is going to be for them. Oftentimes what I see in my own clinic is that the parent is overestimating where their child is with communication skills, and that's what's leading to the breakdown. So the parent might be expecting their child to use a full, complete sentence, but the child doesn't have the capacity to do that whenever the child is overwhelmed emotionally. And so even if your child can communicate to you in full, complete sentences whenever they're relaxed and happy and feeling good, they might not be able to do that whenever they're overwhelmed and on the verge of a tantrum. So really start to think about maybe taking it down a level to something that is just below where your child functions typically when they're calm, and having them complete that skill. If it's still not working, you might take it down a level even lower than that. You might even take it all the way down to just having a gesture. Some children, whenever they tantrum, lose all ability to vocalize what they need. And so you might just start with a tantrum. Now, the idea with functional communication is that you're giving the child an easy way to get their needs met so that they don't need to engage in the maladaptive behavior. You want the communication to be easier than the maladaptive behavior. This is key because if you're having this difficulty with your kid and it's a pattern across days, weeks, months, years, then what that means is that the maladaptive behavior, aka the tantrum, is effective, okay? If it weren't effective, your kid wouldn't be doing it. They wouldn't do it over and over, all right? So there's something about that tantrum that helps them get their needs met. If it's being cuddled, if it's getting another bite of food, if it's getting a break, if it's getting help. So really kind of think about, what is it that my child is getting? That's what the functional communication is designed to get for your child. Sometimes I have parents who say, oh gosh, my kid doesn't get anything. I send them to their room. Okay, well, that's a break. Sometimes it's a break from a chore. Sometimes it's a break from just having a dialogue about how the kid is frustrated. Sometimes there might be a tantrum that lasts for 30 minutes that ends with the caregiver cuddling the child, soothing the child. That's a really warm, affectionate type of attention. And that could be a part of the reason why the maladaptive behavior is maintained. There's a lot of complexity there, which is a big reason for my disclaimer at the beginning, because I don't know all of you and what's going on with your children. And so sometimes you'll need a professional to really help you to understand exactly what is the consequence that's maintaining the behavior. It can be hard to identify. For many of you guys, it's going to be relatively easy to moderate to identify, especially with the younger the child, like the baby, for instance. If the baby cries every time they get, right before they get food, and then they stop crying whenever you put the spoonful full of food in their mouth, then over time you can start to see a reliable pattern. We can see these reliable patterns with older children too, but normally there's a lot more things that are going on, and that increases the complexity and it makes it harder to find the pattern. So if you're finding it hard to find the pattern and you don't know what your child needs, then you might have to seek out a professional to help you figure that part out, which is fine. There's a lot of research to say that it's actually pretty hard to figure out that pattern. So the big key here with functional communication training is that you, one, want to make the functional communication tool easier than the maladaptive behavior, but you also want to train your child to use it before they start engaging in the maladaptive behavior. So again, this takes a lot of observation on the parent or caregiver's part. So let's say that you know that your child tends to tantrum before a transition. Okay, so before you go in to tell them it's time to get off the video game, you might prepare them for the transition. You might say something like, okay, buddy, we're gonna have to get off the video game in 5 minutes, so I'm giving you a warning now. And then whenever the 5 minutes comes up, you might say, hey buddy, it's time to transition. You can let me know if you want an extra 2 minutes. I actually just combined 2 interventions there by accident. One was a warning. The second one was the functional communication training. And so whenever the parent says, you can ask me if you would like to have an extra 2 minutes, then if your child says, can I have an extra 2 minutes? You want to honor that, right? Because your child's not upset. They're doing exactly as you instructed them to do. And then you just set the timer for 2 more minutes. The thing that you want to do after this is you want to give them a ton of praise because they've actually used their words. And so because they use their words rather than tantruming, they've used a more adaptive behavior to get a need met. So you're actually helping them to slowly transition into coming off of the video game. Now, of course, for transitions, once that 2 minutes comes up, I want you to come in with a ton of enthusiasm and be like, Wow, you did so awesome. You asked for an extra 2 minutes so that you could calmly step away from the video game. I'm so proud of you. The next time that you get on the video game, you can do that again, and it'll help you to feel good and calm and ready to get off the video game. So notice that the first step is that you prompt the functional communication. The second step is that you allow the child to do the functional communication and you honor it. And then the third step is that you praise the child for using the functional communication. Okay? Now your child might have a bit of a tantrum the first time that you're transitioning. Transitions are just hard. And if that happens, I just encourage you to ignore that piece and to just keep moving. The idea with most functional communication is that you want it to be super smooth and quick, that they ask for what they need and then they get what they need so that they see that it's effective. I'm trying to think of something else that might be useful. So let's say that your kid wants choice with what clothing to wear. Let's say your kid always has a tantrum in the morning because they want to wear what they want to wear. So then you can do some functional communication training there, and you can pull out 2 sets of clothes for them. And you can say, Susie Q, you can tell me I want to wear the red one or I want to wear the blue one. Or if they're a younger child who doesn't have quite all those vocalization skills yet, you can say, Susie Q, you can point to the red one or you can point to the blue one. And allow your child to choose the one that they want. Notice that I did take down the choice to just 2 options. That would also be a second strategy, a part of functional communication training that isn't exactly functional communication training, but just an additional method. And so if you're having difficulty with choice, limiting choices might be a way to start reducing tantruming as well. Okay, so we've covered a couple of things. 1 is to make the functional communication super easy. 2, honor it when it happens. And then 3, make it preventive. So you want to prompt your child to use it right before they need it. If you're prompting your child to use the functional communication right after they enter the tantrum, it's a little bit less effective because your child is still engaging in the first signs of maladaptive behavior that historically has led to them getting what they want. And you really want them to learn a new history that they have to do the functional communication training or the tool there. So asking for what they want or pointing to what they want or doing that word approximation to get their need met, and then extinguishing the maladaptive behavior by creating no need for it to happen because they got what they wanted by just asking for it. Okay, so that's functional communication training. I think it's a super awesome tool. I use it all the time, especially with young kids. I also use it a good bit with my older kids whenever they're having difficulties advocating for themselves and working through transitions and whatnot. And okay, great. So I will see you guys next time. And again, if you have any questions or concerns about functional communication training, I always encourage you guys to reach out to your provider. You can always look at EnildaClinic.com and reach out to me to learn more too. All right, see you next time. Bye.